I'm Dr. Matt Larson. I'm a child psychiatrist working at the Behavioral Health Center for Irmac in Idaho Falls. I specialize with teenagers, and today we're talking about managing anxiety. Anxiety itself is actually normal. An anxiety disorder is when anxiety becomes so overwhelming that it literally disorders our life. It makes it so we can't function, we can't enjoy friends or family, make it to work. Life becomes unlivable because of anxiety disorders. Anxiety disorders are when people become irritable and they're stressed and they're restless, they don't sleep well, their muscles tense up, and they get to the point that they start avoiding things. They avoid whatever stresses them out. They avoid the grocery store, they avoid their boss, they avoid the coworker they don't like, and their world gets smaller and smaller, disordering their life. There are many causes of anxiety disorders. If there were 4 I would list, the first would actually be genetic. If your parents had an anxiety disorder, you're more likely to have one yourself. That's only about 1/3 of the story. The second cause is when people try to avoid natural anxiety. We're supposed to feel anxious. I feel anxious being filmed. That's normal. It's when we work so hard avoiding it that it actually creates the disorder. Some people try to avoid it through drugs and alcohol. They drink, they feel less anxious. They smoke, they use marijuana, they use other drugs, and it actually creates an anxiety disorder. The same thing happens with medications. People will go to Xanax and Valium and other things like that to diminish natural anxiety, which then makes it so they can't handle any anxiety, leading to an anxiety disorder. The fourth is life stressors. We have things that are wonderful that are very stressful in life. Leaving home, going to college, joining the military, getting married. Any of those are huge changes in our life. And while we'll say they're a good change, they're extremely stressful. Those are things that can set off an anxiety disorder. Same thing with pregnancy, giving birth. A lot of women have postpartum depression. A lot of women also have postpartum anxiety. The first misconception is that anxiety itself is bad. We spend a lot of our lives trying to avoid bad emotions. We've labeled sadness as bad, and fear is bad, and anxiety is bad. And honestly, they're there to help us. Our mind created these things to help us in situations. Anxiety makes us practice so we don't make mistakes. It makes us pay more attention when we're prone to make a mistake. When we're driving on an icy road in Idaho, it makes us grip the steering wheel, dilate our eyes to pay more attention, and move our foot over the brake instead of the gas to be safer so we don't wreck. Anxiety saves us and helps us. We shouldn't avoid it. Another misconception is that anxiety happens alone. People will assume you have depression or you have anxiety. They somehow think that if you have both, you must have bipolar disorder or something like that. Most people who have a depressive disorder also have an anxiety disorder, 58%. 30% of people with anxiety also have an alcohol and drug use problem. The same is true of attention deficit disorder. 30% of people with anxiety disorders also have attention deficit disorders. They often go together. The treatment of anxiety starts with therapy. Therapy by far works the best, has the best long-term results, and has the fewest side effects. This can be done starting with a school counselor or a social worker. A therapist will know when they can help you and when they can't. And if they can't, they will likely send you to a prescriber because medication is the second treatment for anxiety. Those are usually with medications like antidepressants. And often once you start an antidepressant, then the therapy works better and you can work through the therapy. The goal being in 6 months, you're going off the medication. And in a year, you're not in therapy anymore. The highest level of treatment is inpatient care, meaning you're at the hospital, staying there overnight, getting hours of therapy a day, good assessments and medication adjustments. This is for people who are so anxious that they'd rather be dead. They're so anxious they've actually considered ending their life, harming themselves. It's to the point they're not sure they'll be alive the next day or injured the next day. That's when they need to go to the emergency room and tell them, I need to be admitted for a few days because of anxiety, depression, all the things that go with terrible anxiety. If you're worried about yourself or someone you love because of anxiety or any other problem, have them call this number and they can direct you to the right person for help.